So today we're going to discuss on a very important topic, which is what? Triage. Triage. It comes out in exam very well, so we need to know it. We need to understand it. We need to have a perfect understanding about it. I welcome all of you back to our simplified lectures. Firstly, before anything in this academy, we give God Almighty praise. So we give God praise. So I want us to write before I explain. This comes out very well in council exams, so you need to know them. So triage is a systematic process of sorting and prioritizing patients according to the severity of their condition in order to provide timely and effective care when medical resources are limited. So I come again. Triage is the systematic process of sorting and prioritizing patients according to the severity of their condition in order to provide timely and effective care when medical resources are limited. It is commonly used in emergency departments, disaster situation, mass casualty incidents, and military medicine. The main objective of triage is to save the greatest number of lives by ensuring that patients with life-threatening conditions receive immediate attention, while those with less urgent problems are treated later. Please notify me, can you hear me? All right. So triage simply means what? Sorting. When you sort, you prioritize patient's care. I will explain, but I want us to write down. Please, if you can hear me, notify me in the comment section. So the term triage originates from a French word, trier, meaning to sort or to select. The concept was first formally applied in medicine during the wars in the late 18th century. It was developed by Baron, a French military surgeon, who recognized that treating wounded patients based on rank rather than medical need led to what? Unnecessary deaths. The objectives of triage include to save the greatest number of lives by prioritizing critical patients, to identify life-threatening conditions early and provide immediate intervention. Number three, to ensure fair and efficient use of available resources such as staff and equipment. Number four, to reduce overcrowding and delay in treatment. The objectives of triage. Number one, to save lives by providing immediate care to patients with life-threatening conditions. This I want us to write before any explanation. Number two, to prioritize treatment based on severity and urgency of patient treatment. Number three, to optimize the use of limited resources such as medical staff, equipment, and time. Number four, to reduce overcrowding and delay in emergency departments and disaster settings. Number five, to ensure organized and systematic patient management, allowing continuous reassessment and appropriate recategorization. What are the principles of triage? Number one, assessment-based prioritization. Patients are treated according to the severity of their condition, not order of arrival. This is where you should listen very well now. the principles of triage. Number one is what? Assessment-based prioritization. So patients are treated according to the severity of their condition, not order of arrival. Make sure you are writing down for your exam. Write the most important points. Please, I want your comments on the comment section. If you can hear me, notify me that you are following. If you have questions, notify me with your questions. If you are following, notify me. If you can hear me, notify me you can hear me. So number two, maximize survivor. Care is focused on saving the greatest number of lives. Number three, fairness and equity. All patients are treated without discrimination. All right. So I'm impressed for your comment. I'm impressed. All patients are treated without discrimination based on social status, rank, or personal characteristics. Now, what we are doing now, based on your curriculum, we are treating Unit 3. Everything in Unit 3. We're going to treat it tonight. Everything in what? Unit 3. All right? So let us continue. So efficient resource use, limited staffs, equipment, and time are allocated to achieve optimal outcome. Now, let us explain. Whenever you hear the word triage, it means what? Simply sorting and prioritizing patients based. You are not going to end there. It means what? Sorting. Now, nose brain shortcuts. Let me use this to explain it for you. Many of you, when you want to cook certain meals, let's use rice as an example. There are some rice that has stones inside. You don't, if you're a good chef, you don't, if you're a good chef, you don't cook everything all together. Rather, you do what? You sort out the stones and remove it. And do what? Prioritize cooking the main rice. That is what? Triage. So bringing it to the nursing or midwifery circle, which we are treating now for your exam. Whenever you hear the word triage, don't ever forget it. Triage means what? Sorting and prioritizing patients according to the severity. So you bring out the stones, you bring out those that are more healthy, and you focus on those that are less healthy. So this is to give what? Timely and effective care. So as a triage student, because this is a new addendum in nursing curriculum and you will see it in your exam, as a triage student, even if it is your family member that is there, but your family member is not seriously wounded, and you see someone you don't know that is seriously wounded, as a triage nurse or midwife, you have to do what? Attend to the person that is seriously wounded. For the midwives, if a woman comes and she is still in 2 cm dilation, and that one is your wife or a family member, you will have to neglect that person and focus on the person that is 8 to 10 cm dilation, cervical dilation. In nursing, if there is an accident or an incident where there are mass casualties, triage entails and teaches us that we must prioritize those that need the care most, more than those that does not need it. Though all the patients will be attended to, but triage is tailored and focused mostly on those that need it the most. Are we together? Please notify me, are we together? So using our Nosbrady shortcut, where we looked at the salt and the stones and the rice, we do what? We remove the stones in order to cook the rice. So we remove those that are more healthier. We remove those that are more healthier in order to do what? Treat those that need that urgent attention in order to cook the rice. Because if there are stones inside the rice, I believe this what I'm saying, the stone and the rice, is just a nose shortcut to help you understand. Are we together? So cooking the stones and the rice will bring an ineffective meal. So treating those that are severely wounded at the same time with those that are not severely wounded will not bring an efficient care. So triage is just a systematic process of sorting. When you sort, you remove the stones. Sorting, you find those that are severely wounded and prioritize them as the number one patient you should attend to, not minding who they are. Are we together? So the word triage, the history of triage is that at first it is derived from a French word, trier, which means to sort or to select in case of your exams. So during the war, it was developed by a man named Baron, a French military soldier. Number one, it is a French word, which means to sort or select. It is developed by a man called Baron. Are we together? A military surgeon. He's a surgeon. So at first, he was treating soldiers based on rank. Once this person is the general, he will treat the person, even though the person has a cut. But this led to unnecessary casualties. So they now derived a means of treating patients equally, thereby reducing the casualty. So, but before the initiation of triage, patients were treated based on rank. Once the person is the general, they treat the general, leaving the less soldier. Once it's 2-star general, they leave the 2-star, treat the 3-star general, and leave the normal soldiers. But this led to a lot of casualty. And this man called Baron now derived a means of what? Treating patients equally, whether it's a 5-star general, 2-star general, 1-star, or ordinary recruits. The surgeon treated all of them equally. That led to the what? To the what? Initiation of that word triage, where patients are being treated based on number one, severity. How severe is that case? Before, whether the person has money, whether the person has fame, whether it's a celebrity, whether anything, whether it's your family member, a triage nurse must treat a patient based on what? Severity, in order to what? Prioritize efficient patient care. Are we together? Is this well simplified and understood? Please notify me. All those that have been sending their comment section, their comments, I'm impressed. Notify me, is this way simplified? Using the rice analogy and the stone analogy, whereby we remove the stones in order to have a perfect meal, whereby we remove those that are slightly injured in order to do what? Treat those and what? Maximize survival of the patient. Looking at our main objective, it is to save the greatest number of lives, to identify life-threatening conditions early and provide immediate intervention, to ensure fair and efficient use of available resources, to reduce overcrowding and delay in treatment in emergency setting. Now, I don't know your different colleges and universities and schools, but you should know what we are discussing on is a new addendum called emergency and disaster nursing, which entails or deals with what? Anything emergency, how a nurse should react in emergency situation, in a disaster. Are we together? We- So we use efficient, there is efficient resource use. There is efficient resource use. So the little resources you have to do what? Use it efficiently. So we are treating patients based on what? Order of arrival. Not based on order of arrival, but based on severity. Even if a patient came very early, but he has a minor case, you have to ignore that patient to treat the patient that came with a more severe case. Now, I'm going to be giving you some shortcuts that will help you answer the right thing for exam. And I'll be telling you where question comes from more so that you can scale through for your exams. So we have types of triage. Number one, we have primary triage. It's a rapid sorting of patients carried out at the scene of an emergency. So if there is gas explosion and you as a nurse or a midwife, you rush to that scene, the sorting you do, the removal of the stones from the rice that you do at that junction, at the scene of disaster is called what? Primary triage. Don't forget it again. Primary triage, the sorting, the prioritization of patients based on severity that you do as a nurse or a midwife in emergency ward, the sorting you do at the scene where it occurred, at the scene of emergency is what? Primary what? Triage. Don't forget it again. The rapid sorting carried out at the scene of emergency is what? Primary what? Triage. So we have secondary triage. Secondary triage is performed after initial stabilization, usually done in the hospital. So the one that is being done after you treated the patient at the scene of emergency and the person is being brought to the emergency ward, that triage, because you are still monitoring them. There are patients you will see, they had a minor problem at initial stage, but before getting to 5 hours later, the patient's situation got worse. So you have to do what? Keep triaging. You have to keep sorting. So that sorting you do in the hospital after initial one is called secondary triage. Secondary triage. Then the continuous reassessment of that patient during ongoing treatment is called tertiary triage. Don't forget it again. The removal of stone from rice in the kitchen is primary triage. Why the food is being, when you are still cooking the food, it becomes secondary triage. Before everything is done, it's tertiary triage. I'm using this analogy to help you never forget it. So at the scene of emergency, the care that is being given, the sorting that is being done is what? Primary what? Triage. After initial stabilization, some patients can still relapse. So you still have to do what? Sort again. The sorting you do in the hospital is called secondary triage. Then the one that is done after is what? Tertiary what? Triage. The continuous assessment, reassessment doctors do is what? Tertiary triage. Many nurses don't know about this. All they do is what? Tertiary triage in the hospital. So for being in tonight's class, you are learning that the one you do in the scene is primary, the one done in the hospital is secondary, the continuous reassessment is what? Tertiary what? Triage. Then the fourth type, we have mass casualty or disaster triage. This is the main type of triage, where there are high number of victims that exceed medical resources. There are 5 injections, there are 5 diclofenac in the hospital, and all patients are bleeding and in pain. So you have to do what? Prioritize those that need it the most. Those that need it the most. That is what? Mass casualty or disaster triage. You have to ignore those because of the less availability of medical resources. You have to ignore those till more aid comes. You have to ignore those that need it less and focus on those that needs it more. Are we together? Please notify me. Are we learning? Are we together? Are we learning? Notify me. Are we together? If you are learning, if it is simplified, notify me. All right. God bless you. Now, we have categories of what? Triage. Categories of triage. And this is where question comes from more. We have the word, the red. This is priority one, red, immediate. These are the most important set of patients you should attend to more as a triage nurse. There are life-threatening injuries that need urgent care. Example, bleeding. Once you see anything in your exam bleeding, it shows that it is affecting the what? It is affecting the what? Circulatory system. The heart is in trouble, the kidneys are in trouble, the brain are in trouble. Every part of the body needs blood. So once you see bleeding, anything that concerns blood, where we will know that it is what? Red coding. Red what? Red color coding. So shock, red color coding. Major limbs, we have moderate burns, we have stable abdominal pains. These are minor from the word minor head injuries. They are classified under, please, are we together? They are classified under what? Yellow. This one is what? Green. Minor, priority 3. We have minor injuries. Can the person is walking around, it's just a minor, a cut, a laceration, it's just minor. All right? So we ignore such person. Then we have the black. The person is unlikely to do what? To survive. The person is unlikely. All right, we are going, let us finish this unit 3. So artificial respiration, whenever you see the word artificial respiration, it is an emergency procedure used to provide manual ventilation to a patient who is not breathing or breathing adequately to maintain oxygenation of vital organ until spontaneous breathing rate or advanced care is given. Artificial respiration is an emergency procedure. Indication, we have respiratory arrest, we have drowning, we have choking, we have drug overdose, we have severe trauma, we have unconscious patients. So all these are reasons why we give what? Artificial respiration. So method, we give mouth-to-mouth respiration. We use bag valve mask, which we call ambu bag, to give what? Artificial what? Respiration. So why mechanical respiration is the use of ventilator machine to assist or fully control breathing in patients who cannot maintain adequate ventilation on their own. Note the difference. We have what? Artificial respiration, and we have what? Mechanical respiration. So whenever you hear the word mechanical respiration, think of this word, this M, use of what? Machine, to give someone, to take over the person's lungs. But artificial respiration, natural respiration is you using your nose to breathe. Artificial respiration is someone aiding you, either using oxygen mask, which is bag valve mask, which is amber bag, or mouth to mouth. That is what artificial respiration. Natural respiration is you using your nose, your nostrils to breathe. Why artificial respiration is someone aiding you to breathe. Why mechanical respiration is use of machine, from the word mechanical, M, we do what? This with using of what? Ventilator machine to assist your breathing. We have types. We have the invasive. Invasive means using endotracheal tube or tracheostomy. We have non-invasive. Now, that's not where we are going to. We have non-invasive. We have volume controlled and pressure controlled. Now, because I want to go to places that will come out in your exams. So CPR, we all know what CPR is, cardiopulmonary resuscitation, from the word cardio, heart, pulmonary, lungs, resuscitation. So we are trying to resuscitate the heart that has stopped beating and the lungs that has stopped oxygenating the body. So that is why it's called cardiopulmonary resuscitation. We are resuscitating two systems, cardiovascular system and respiratory system. That's why it's called CPR. Are we together? So for being in this academy, you should be a perfect nurse and a nursing student or a midwife. So we all know, but I want us to dive into the main point: indication, cardiac arrest, respiratory arrest, drowning, choking, electrocution, etc. So we have what we call medivac. The full name for medivac is what? Medical evacuation. So whenever you see medivac in your exam, it's an organized process of transporting injured, ill, or critical patients from the scene of emergency or disaster to the healthcare for treatment. Whenever you see the word medivac, medical, medivac, medical evacuation, medivac, don't forget it. Medical evacuation is an organized process of transporting injured, ill, or critical patient from the point of. So whenever you see this, remember that Nurse Brain said it just deals with what? Transportation. It just deals with what? Transportation, transporting a patient from the point of trouble or injury or emergency or disaster to the hospital. That's what medivac. So we have types of medivac. We have ground evacuation, use of ambulance and vehicles. We have air evacuation, certainly not in Nigeria. Use of what? Helicopters, aircraft. We have water evacuation, use of boats, ships. We have combined evacuation, use of multiple transport mode. Now, after noting this, we have what we call en route care or en route care. So this refers to the continuous care and monitoring given to a patient during transportation from the scene of emergency to a healthcare facility.